Gene therapy, immunotherapy, and cancer treatment. What we're going to be going over is what it is, how it works, what happens, ways to try and help, and how they have evolved and what is being planned. What is cancer? Cancer starts when cells that are abnormal multiply and divide in an unregulated manner. In most cases, the immune system kills off the abnormal cells. However, cancer cells are able to escape the immune system's radar, so it lets them branch out. Treatments for cancer include targeted therapy, gene therapy, hormone therapy, immunotherapy, radiation, and chemotherapy, and surgery. Section 1 is immunotherapy. What is immunotherapy? Immunotherapy is a biological active substance derived from living beings to enhance a body's defense system capacity to combat center. How does it work? Cancer cells use the following methods to escape destruction by the immune system: concealing themselves from immune cells, switching off immune responses, changing healthy cells in the vicinity, and immune therapy changes these cancer cells' defenses. The key functions are helping the immune system recognize cancer, activate protein antibodies that kill cancer, empower T cells to destroy cancer, and that antibodies are guided to target and kill the cancer cells. Immunotherapy versus chemotherapy. Chemotherapy uses toxic drugs and damages healthy cells, and it can increase hair loss, nausea. So chemotherapy can cause and have some side effects. Immunotherapy uses biological agents. It may still harm healthy cells, and there are side effects to immunotherapy like inflammation, skin reactions, and flu-like symptoms. Different types of immunotherapy are monoclonal antibodies, immune checkpoint inhibitors, cancer vaccines, immune system modulators, oncolytic virus therapies, and T-cell transfer therapy. The side effects of immunotherapy are organ inflammation, immune overreaction, skin rashes, flu-like symptoms, loss of appetite, swelling of hands, feet, and face, flu-like symptoms after the infusion, and weakness or muscle pain. How immune therapy can be given? It can be given through IV infusions, oral pills, topical creams, and intraversical bladder delivery. The treatment frequency it depends on cancer type, stage, the type of immunotherapy, body's reaction, and it can be used differently daily, weekly, monthly. Section 2, cancer diagnosis, risk of prevention. How to diagnose cancer? There are multiple different ways like PSA tests, mammograms, pathological reports, CT scans, and sentinel lymph node biopsies. There are multiple risks of cancers, including tobacco use, obesity, alcohol, stress, and unhealthy food, genetics, and environmental toxins, and finally radiation. There are multiple ways to prevent it, like exercise, physical activity, vegetables, HPV vaccine, limiting alcohol, and weight management. Section 3 is gene therapy. What is gene therapy? Gene therapy is a treatment that changes the patient's DNA to eliminate the disease. It is quite new and still in development phase, but it is ranked as one of the most potential cancer therapies. At the moment, gene therapy is a treatment that changes the patient's DNA to eliminate the disease. It is quite new and still in the development phase, but it is ranked as one of the most potential cancer therapies. They all require the insertion of new genetic material into the cells. How does it work? Replace malfunctioning genes, halts the function of harmful genes, introduces new normal copies of the gene that are healthy, and is able to correct disease that result from mutations in genes that have been inherited. Gene therapy uses that are FDA approved: sickle cell disease, beta thalassemia, hemophilia, spinal muscular atrophy, and Duchenne muscular dystrophy. Section 4 is comparing gene therapy and immunotherapy. The main differences are that gene therapy is the process of fixing or changing the DNA inside the cells, and immunotherapy helps the immune system to find and kill the cancer cells. The target of gene therapy is DNA, and the target of immunotherapy is the immune system. The goal of gene therapy is to correct the mutation. The goal of immunotherapy is to fight cancer. The tools are CRISPR for gene therapy, as well as viral vectors. For immunotherapy, there are antibodies, CAR T, and vaccines. There are diseases for gene therapy, which include genetic diseases and some cancers, and diseases for immunotherapy are multiple cancers. Section 5, overlapping CAR T-cell therapy. And then Section 6 is current research. So the focus areas of it are overcoming immunotherapy resistance, predicting patient response, developing new immune targeting drugs, and reducing side effects, as well as expanding CAR T to more cancers. There are clinical trials, and you can find these clinical trials through NCI-supported clinical trials or Dana-Farber clinical trials database. Section 7 is where immunotherapy is offered. The City of Hope is a leader, and it has and shows you different leadership things for immunotherapy research, immune effector cell therapy, and gene therapy programs. Section 8, just going to go over everything that we have talked about. Immunotherapy releases the body's defenses. Gene therapy changes the faulty genes. So basically, it releases the body's defense. That way you can get rid of the bad cells and good cells, so that way you can generate only good cells. They are both capable of treating cancer, and these are some treatments that use both. CAR T-cell therapy is the clearest example of overlap. Immunotherapy has been open to the world for a great number of diseases, and especially for cancer. Gene therapy is developing very fast to be the solution to the problem of the genetically inherited diseases. And scientists are working on both ways to perfect both of the methods, so gene therapy and immunotherapy. This is the works cited. And that is all.